September 30, 2025. I'm Dr. Duke Majan. Our patient is from Florida. He has back pain for 25 years. He has a large disc herniation, left L4-5 with annular tear. That tear is causing back pain. The herniation is causing leg symptoms. We're going to go in. We're going to fix that annular tear, disc herniation at L4-5. He also has facet joint pain. You can see the arthritis in the facets at L4-5. Very obvious shot. Right where my needle is. Show us that, Jordan. Shot. Yep, that's the arthritis. X-rays are good for identifying arthritis. He's got it, that's for sure. Now, we're not using any contrast dye for his discogram. Why? Because he has concerns about his kidney function, and we don't want to compromise kidney function. Most people can handle the omnipaque dye, no problem. So we're not using any omnipaque for him. If you have questions, feel free to type them up, but you are watching endoscopic laser spine surgery done at Duke Spine Institute. We've been performing this exact surgery for 20 years with 0 surgical complications in 20 years, over 2,700 laser procedures done, with over 200,000 patients treated at Duke Spine Institute. Yeah, no worries. Take your time. I'm going to put a little numbing medicine in. Any questions, feel free to ask. In the meantime, Henry, take us through these 30 different causes of back pain that people get. I'm Dr. R. Duke Majan with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Machen. Thanks for joining us. Welcome back. You've seen our video on the 30 different causes of back pain, and this patient has one disc, two facets, two sacroiliac joints, and I'm pretty sure he has a piriformis as well, correct? We're just not treating it.
Correct.
So he has 1, 2, 3, 4, 5, 6 different causes of back pain. The average patient with chronic back pain has four causes. That's 4 specific pain generators. We call the structures in your back that cause pain generators. It's interesting, isn't it, when you listen to me talk about pain generators. But the first time, I learned as a neurosurgeon that not everything in your body causes pain was as an intern in neurosurgery. You see, we all assume that poking around inside your body with knives and sharp things will cause pain, right? No matter what you touch. But it's not true. Most of the tissues in your body don't have pain sensitivity. In other words, you can rip them out with the patient awake and they won't even feel it because there's no pain fibers. But certain structures have pain fibers. Certain structures do. And one of the things you learn in your early years as a surgeon is what has pain fibers. For example, take the bones. The inside of the bone marrow, has no pain fibers, but the outside of the bone, called the periosteum, does. The periosteum is very pain sensitive. As a matter of fact, we have to numb it up if we're going to operate on it. The brain, if you're doing brain surgery, you can do it on an awake patient. Why? Because the brain itself does not have any pain fibers. You can cut the brain out. You can take half of someone's brain out and they won't even feel it. Okay? You all saw Silence of the Lambs 2, right? Point is, the dura has pain fibers. That's the covering, a white covering around the brain. The arachnoid has some pain fibers. The pia does not. and the brain substance does not. Therefore, you can do brain surgery and the patient won't even feel any pain. But there are certain structures that have to be numbed up. You've all heard of awake brain surgery. Well, that's what allows it to happen. So, as we're heading down to this disc area to work on this herniation, there are certain things that do hurt, like the fascia around the muscle, the periosteum, and the annulus, outer annulus, definitely can be painful. But there are a lot of things that don't hurt, like the inside of the disc doesn't hurt, for example. You guys see the tear right there? That's the annular tear.
Yes, we do.
That's where the pain comes from. It is right here where there are pain fibers. That's what causes patients' back pain. Those pain fibers in this area that we're working on right now. And Dr. Berndes will actually see the patient's heart rate increase and their blood pressure increase as we get closer and closer to the more pain-sensitive structures. Right, Dr. Berndes? Yeah. Dr. Berndes made that observation, explained it to me. That was the first time I had heard that. But it's true. The closer we get with the laser to the more painful areas of the disc, the more the heart rate goes up, the blood pressure goes up. So we have to watch those things. Keep an eye on them. Any questions from our audience?
Yes, we have a question coming from Ariana on YouTube.
Ariana.
Saying, hi, Dad. It's Ariana.
Dad.
I'm on my study break. How's that surgery going? Miss you.
Oh, my gosh. Everybody's saying hi, Ariana. Nikki is saying hi. Everybody, Dr. Berndes, everyone says hi to you. Ariana is taking tests at Rutgers in New Jersey, and we all wish you best of luck, Ariana. The surgery here is going fantastic. This is our second surgery for today. Our last surgery, she's doing really good. She's from California. And this patient will do just as well. We miss you terribly. Everybody here misses you. Ariana has worked at Duke Spine for several years now. She comes in the summertime and works when she's not in school. And she is very smart and picks up on things very, very quickly. She's going to make a wonderful addition to the Duke Spine family someday and taking great care of patients, I think, if she wants to. Hopefully she does. Say hi to all your roommates out there and give them our best.
She says, I miss you all a lot, especially Nikki.
Oh, wow. I think Nikki's blushing. You just can't tell because her mask is on. All right. Thank you, Ariana.
And we have a comment coming
sure.
from Poodle Dog on YouTube.
Poodle Dog. All right, Poodle Dog. I think we had Poodle Dog commenting last week, didn't we?
Yes, we have. They came on multiple times.
All right, Poodle Dog.
Saying, Dr. Duke, you are amazing in helping people. I will be seeing you soon. Hope you help me too.
Thank you, Poodle Dog. Well, Duke Spine is all about trying to help people get out of pain. That's what we do. Our number one focus is curing back and neck pain. Our number two is curing joint pain. So we do shoulders, hips, and knees, and we use our Duke plasma rhizotomy procedure. It's quite simple. I was just talking about how our bodies have pain fibers, pain nerves that go to certain structures, right? But not everything in your body has pain nerves, okay? So certain things are not painful, but one of the things that is painful is joints. Your knees, your hips, your disc, your facet joints, all of those joints have pain nerves that go to the joints and innervate the joint. And those pain nerves, when you have arthritis, for example, in your joint, those pain nerves are overactive, constantly sending your brain pain signals. and they're very disruptive to life. So our second priority here at Duke Spine is our joint program, where we can actually go in and kill the pain nerves to hips, knees, shoulders, even toes and fingers and wrists. We've done pretty much every joint in the body at this point, and we've had great success at curing pain. So before you consider a fusion of a joint or a joint replacement, I strongly recommend you meet with me or Dr. Patel and see if you're a candidate for one of our procedures that are minimally invasive, where we go in and basically destroy the pain nerve rather than do a full joint replacement, okay? No one should have a full joint replacement, in my opinion, unless they absolutely need it. And the only way to know if you really need it is to try the Duke plasma rhizotomy first. Okay, this patient, we're almost done. You can see the end of the tear right there where the laser fiber is. I've got to finish cleaning up this tear. There's also a pretty big herniation just past the tear I've got to deal with. So I'm going to be reaching in and grabbing. I would get Grabzilla in the room just in case we need Grabzilla. All right? This is the kind of case where we might need Grabzilla. Thanks for the comment. And good luck, Ariana, with all your tests. I know you're going to do amazing. And you've studied so hard. I'm so proud of you. Mom and I are very proud of you. Oh, by the way, I named an orchid after my daughter, Ariana. There's an orchid hybrid that has never been named before, and I had the opportunity to name it, and I called it Ariana's Vivacious Splendor. So it's Vanda Ariana's Vivacious Splendor. It's an absolutely beautiful orchid. It has a flower that's one of the biggest flowers in the entire orchid family. It's gigantic and it's beautiful. It's red and yellow and got some purple and pink in it. And Ariana will be able to see it one day when she comes home. I've actually got a picture of it. It's beautiful. This Vanda orchid is, well, it's about the size of a car. It is huge. Yep. It's about a 20-year-old hybrid. Actually the same age as Ariana. 19, 20 years old. Right around the same age as Ariana. So this orchid hybrid was born probably the same time Ariana was born, in 2006. And these orchids, they don't flower until they get about 3 or 4 years old. And this one has been flowering for years. I was fortunate enough to acquire it from a grower here in Florida. And shortly after found out it didn't have a name. It needed a name. So I talked to my daughter Ariana about it, and we came up with a name. And now it's registered in the Royal Horticultural Society as Ariana's Vivacious Splendor, a name that she and I picked together. Pretty neat stuff. All right, we're almost done. This is the L4-5 disc, the most common disc in the human body to have problems. More than anything in the neck, more than anything in the thoracic, the lumbar spine has more symptomatic herniations than any other part of your body. And the L4-5 is the most common herniated disc to cause symptoms. L4-5. Henry, have we shown our video on how a disc becomes so painful?
Not yet.
Why don't we do that?
Of course.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. We are just wrapping up the Duke laser disc repair for this disc, L4-5, on a patient who, I believe he's a fireman, correct? From Florida? Yeah. Spends his life fighting fires, saving lives, and has been suffering with his back for years. So we're fortunate enough to have the opportunity to help him. He chose Duke Spine and traveled here from pretty far away in Florida. Can't give you any more information. Don't want to give away his identity either. So, but he is a fireman. We get a lot of nurses, a lot of firemen, policemen, sheriff. We even get doctors, lawyers, politicians. Still waiting for an insurance company executive. All right. These are all pieces of herniation floating out. You guys see these?
Yes,
So,
we do.
very big herniation. We're underneath it now, and we're removing little pieces of it, a little bit at a time. We call it a debulking. Debulking, it means taking parts of a tumor out. This is not a cancerous tumor, but a herniation is a tumor. It's a mass. Tumors are masses. Lumps, basically, masses. They have mass. Doesn't mean they go to church. Ba-dum-bum. I thought it was funny. Alrighty then. Any other questions?
At this moment, no current questions. So in the meantime, we can show the audience of how it is that we cure herniated
I love it,
discs.
Henry. Thank you. Great job. Yeah.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. We brought in Grabzilla, which is the Godzilla of all grabbers. Huge. This is our normal endoscopic grabber. Look at the size comparison. So Grabzilla is bigger. It also has a different design. It's able to grab big pieces of herniation, especially the ones that are hiding medially. Because I can articulate the tip, I can actually pull it up and grab, or I can go straight and grab. So by going up, I'm going towards where the herniation is its worst. So it's helpful. And we got out about 3 big pieces with Grabzilla. Now I'm gonna go back in and finish up. I think we should be just about done with this herniated disc. Hold on. All right, there's the epidural fat laser. Little bit of herniation right there. I'm gonna take care of that and we should be done. We're gonna end this stream. We'll come back in a moment with our facet treatment. Because remember, this patient doesn't just have pain coming from a bad disc, he also has pain coming from damaged facet joints on the side of his spine. Wow, there's a lot of herniation here. Maybe I need to grab Zilla again. Berndes? Yeah. Is he, how's he doing? Good? All right. So what's happening, just so you guys understand, at 12 o'clock is sort of where the herniation is hiding, and I've been removing the base of the herniation, so the tip of the herniation has been falling back down into the disc where it came out, and that's, I keep removing more and more of it. So this is all like the middle of the herniation, right in here. So I'm going to bring Grabzilla back in here one more time and try to get that out. Not really getting much of anything with Grabzilla. No. Just about done. So that means we've gotten the bulk of it. Let's see, laser. Any questions from our audience?
At this moment, no current questions.
All right. It's looking pretty good. Clean this last bit up and we'll be done. Can't get any more out, so. Now, some people say, Dr. Duke, how do you know you got all the herniation out? The answer is, I know we did not get all the herniation out. There is no way to get 100% of a herniation out. So what we aim for is about 50%. By getting 50, 60, 70%, 50% or more, what you're doing is you're getting rid of the symptoms permanently. So in my experience of treating herniations in the lower back and the neck, if you can get rid of about 50% of that herniation, then your patient's going to be symptom-free. You don't have to get 100%. As a matter of fact, there is no surgery on earth that will get 100% except for going and taking the entire disc out and putting in a cadaver disc, a dead person's spine, basically, which you never want to do. All kinds of problems that happen with that. It's been done in China. The Chinese were the first to do it and probably the last to do it. But knowing the industry, somebody will try to make money off that procedure. All right, there it is. There's the annular defect. You can see the epidural fat right there. We're outside the annular tear. The inside of the tube is 5.5 millimeters, so you can see that tear is only about 3 millimeters. 3 millimeters. So that should heal up pretty darn quick. We're done. Any more questions?
At this moment, no current questions.
All right, let's end the stream. We'll come back in a minute with our facility.